Hi, my name is Erin McFall, and tonight's date is January 8th, 2024. Today, our assignment is to make a portfolio project about the reproductive system. And after reading the Silverthorne textbook chapter, I learned a lot that I did not know before. What I found very interesting was the female portion of the reproductive system chapter. And I have been finding these case studies very interesting, so I chose that to do for my portfolio project today. And along with this, I also made a little matching worksheet about different terms from the chapter. Instead of doing terms from this case study, I did terms from this chapter because I found that would be most beneficial for the upcoming exam. And I would like to apologize. I tried to film this on the Screencast-O-Matic ScreenPal application that was recommended, and for some reason it kept making my computer crash. So I decided that I would just film it like this, and I hope that is all right. I have made a PowerPoint and I will begin going through that right now. I chose ectopic pregnancy because I felt like it is kind of a misconceived notation. I learned about it in my anatomy class this last semester, and I just wanted to expand my knowledge even more, and I just found that this would be an interesting topic. So to get started, I just made an overview slide of what ectopic pregnancies is. So to get started, ectopic pregnancy occurs when fertilization happens outside the oviduct. So the uterus is usually where a fetus is held and grown, but for ectopic pregnancies, this is going to happen outside of that. That is what causes the issues that we will be discussing. So it happens outside of the oviduct. It is a life-threatening condition and one that does not support the growth of an embryo into fetal life. So this fertilized egg, though it is fertilized, it will not have the ability to grow into a fetus. This usually occurs with the fetus when the fetus is implanted into the fallopian tubes instead of the uterus. So the fallopian tubes from the chapter send eggs from the ovaries through the fallopian tubes to the uterus. But during an ectopic pregnancy, it seems to get fertilized within the fallopian tube instead of going down into the uterus. And that is where the pregnancy will begin. And that is what is the issue with these pregnancies. So it will usually implant into the fallopian tube instead of the uterus. This fertilized egg will not be able to develop into a fetus. This can cause detrimental effects to the mother. There can typically be no different symptoms involved in the beginning. So sometimes mothers might not even know, or expectant women might not even know that it is an ectopic pregnancy, maybe even until some of their early scans. It might take them a while to even understand that this is happening to them. A pregnancy test can sometimes provide a positive result, even though it is an ectopic pregnancy. This isn't always going to happen, but sometimes it will. So it's very important to go get those scans done and make sure that the pregnancy isn't ectopic and life-threatening. And I believe that's all I have for this slide. Okay. So when asked the question, how can fertilization occur outside of the oviduct? And I was prompted to be very specific. So to get started, this fertilization found outside of the uterus is found within the fallopian tube. This can be caused by damages to the fallopian tube that is not working properly. So unbeknownst, or maybe beknownst to that woman, she might have complications with her fallopian tube even before this egg has been fertilized. So the fallopian tube cannot undergo its normal function of sending an egg down to the uterus because it is damaged in some type of way. and that causes it to not work properly, hence the ectopic pregnancy. What increases the chances of these types of pregnancies? I have listed a bunch. There's a couple other ones, but these are typically the ones that are seen to be a direct link to ectopic pregnancies in most individuals. So pelvic inflammatory disease is the inflammation of the pelvic floor, and it's an infection of the women's reproductive organs, and it can usually be caused by STDs such as chlamydia. This can increase the chances of an ectopic pregnancy. Smoking can increase the risk of ectopic pregnancy as well. Having an ectopic pregnancy in the past sadly can lead to having another one in the future. Not always. It's recommended to wait about 2 full menstrual cycles before trying to get pregnant again, or even longer if there is other therapeutic other surgeries needed. I'll get into that later. I'm so sorry. Prior fallopian tube issues or surgery can also cause ectopic pregnancies, and the use of IUDs has caused ectopic pregnancies in the past. Whenever you get IUDs, which is a type of hormonal birth control, it says on the list of possible outcomes that ectopic pregnancies might happen, so that is something to consider. And then lastly, age has something to do with ectopic pregnancies. The next question would be, what kind of hormonal complications would you expect in this situation? So in the luteal phase of the hormonal reproductive cycle, usually estrogen and progesterone rise so that the uterus can grow strong and be ready to take on a fetus and help them grow. But sadly, during ectopic pregnancies, progesterone levels are lower than normal, and that can cause these abnormal types of pregnancies. Low progesterone can cause other types of abnormal pregnancies, but it is a direct link to ectopic pregnancies and that hormone being low. Next, why is it a life-threatening condition? So this is a life-threatening condition because the location of the implantation. If the egg continues to grow, it can cause a rupture of the fallopian tube. This is a life-threatening because it can cause internal bleeding. So the fallopian tube can also rupture and burst if it gets to that point, and internal bleeding is obviously a very dangerous thing to happen. This is accompanied by sudden and severe pain. In some cases, the whole fallopian tube may need to be removed. This will inhibit a woman's ability to get pregnant in the future. In rare cases, a rupture of fallopian tube can be fatal. However, this is very uncommon, and in most cases, the fallopian tube can be successfully repaired or removed before that happening. Next, how is it treated, and what are the possible consequences of that treatment? Sometimes the body will detect the issue. The egg might not continue growth on its own, so it will be just reabsorbed into the woman's body on its own whenever it's detected that it's not in the right position. However, if this is not the case, and if it is detected in the early stages of pregnancy, a medication can be administered. This is called methotrexate, and its function is to stop the egg from developing. The tissue then will be reabsorbed into the woman's body. In a more advanced stage of an ectopic pregnancy, there might be a requirement of surgery to remove the egg. In some cases, the whole fallopian tube may need to be removed, and this will inhibit the woman's ability to get pregnant in the future. So this is some of the consequences of this. If the fallopian tube needs to be surgically repaired in some way or removed, that can cause either another ectopic pregnancy or the inability to get pregnant. Next, symptoms of ectopic pregnancy. Some women who have an ectopic pregnancy do not show any symptoms. They might not find out they have an ectopic pregnancy until their early scans. and it shows the problem with the woman's fallopian tube. Then like I mentioned before, some fallopian tubes may rupture due to this. So people who have experienced a collapse in the fallopian tube can be dizzy or lightheaded, experience sharp or sudden intense abdominal pain, feel sick, increased heart rate, look pale. So it's going to be pretty evident probably if this happens, because that is the part of this that could be life-threatening. Hopefully it doesn't have to get to that point anymore with the increase of scans and things like that. But this is my reference sheet. And that is about all I had for the PowerPoint. And then I just wanted to show the matching document that I made to get myself ready for this exam. So I did it kind of as if I was taking a test, just a big matching sheet of a bunch of terms from the reproductive system chapter. So thank you so much for listening to me today. Have a good night.